Welcome to Vision for California, a web series of discussions on California healthcare reform, hosted by Senator Dr. Ed Hernandez, Chair of the Senate Health Committee. Today's guest is Dr. Stephen Green, President of the California Academy of Family Physicians.
Well, welcome to Sacramento. We're going to be obviously talking about the ACA and healthcare, but more importantly about your profession and your association. And first of all, let me say congratulations for being elected president of the association. Just very briefly tell me quickly, when did you get elected and how long is your term?
Thank you very much. I was elected, I started my term in April of this year, and it's for 1 year. I had a year as president-elect before that to kind of get my feet wet and learn what was going on, and the next year I'll be the immediate past president. Hopefully having an active role.
Well, good. Well, congratulations. Let's talk about the Affordable Care Act, but more importantly, the ruling that the Supreme Court made and how we're going to move forward in 2014. Tell me, what do you think the Academy thinks about the recent SCOTUS ruling on the ACA and what it means to you guys?
We definitely consider the Supreme Court's ruling a victory for our patients, especially those who could not afford health insurance before, people who had pre-existing conditions that made them ineligible. We think it's going to be a big step forward in getting millions of more Californians insured and getting them the health care they need.
Good. You know, as you know, I've done some select committee hearings on workforce, and one of the things that's really important to me is the distribution of primary care providers, especially in rural and inner city communities, or the lack of distribution. Tell me, how do you feel the Academy of Family Physicians is preparing to make sure that we meet that demand? Because as you know, we're going to have close to 4 million new Californians coming on the rolls pretty soon, and you guys are going to be kind of front and center. So how are you guys preparing to undergo the ACA and the implementation of it?
Yeah, absolutely. That's a good question. It's going to be a challenge for us to be able to provide health care for millions of more Californians. A lot of our strategy is going to be centered around redesigning how we deliver care. We can't just continue to do the same thing we were doing and try and go faster and faster. Patient-centered medical home is one of the areas that we're really focusing a lot on. We think that if we can deliver care in teams more efficiently, we can take care of far more people.
Mm-hmm. Well, let's expand a little bit upon that. Mm-hmm. You know, obviously, there's going to be a great need. We need to look at getting more individuals to do primary care, but I believe a big part of that is having residency programs in the areas where the greatest needs. And as you know, Medicare funds that, and we need to work in collaboration with the feds, but more importantly with the various entities to be able to do that. How do you see us working collaboration to make sure that we get more residency programs in those particular areas of need?
Well, one of the best things that's come around lately is you're a co-author on Senate Bill 1416, which we think is a great step forward. The idea would be we create a voluntary fund to help promote residencies in these areas of need. One of the advantages of having a family medicine program in a rural or an underserved area is the residency programs often end up being a large portion of the caregivers for the Medi-Cal patients and people who really are in need. Also, there's a lot of data showing that residents tend to stay near where they do their residency. Yes. So the fact that they do residency in an underserved area gives us a fighting chance of having more family physicians in that area.
Yeah, I couldn't agree with you more, and the goal is to make sure we do residencies where there's a need, because those individuals are more likely to stay there. But I guess the next question I have for you is, how do we encourage more individuals who go to medical school to go into primary care? Because as you know, more and more are emphasizing specialty care, I guess because of the poor reimbursement rates you get for Medi-Cal, the poor network adequacy we have. So how do we encourage more students to go into primary care?
It's another issue that's very important to all of us. One of the things that will help with that is we need to make the practice something that's attractive to medical students. If students come in and see the doctors sort of running around on a hamster wheel, not having a lot of help and doing everything themselves, it's not the kind of thing that the students want to do. That's why we want them to sort of see this more team-based approach of the patient-centered medical home Another area that we have is med students now are finishing with tremendous amount of debt. So when they're choosing what specialty to go into and they have $200,000 in debt, it obviously can influence what specialty they choose. Things like loan repayment programs are another way that can sometimes influence students to be able to afford to do primary care if that's what they really want to do.
Well, what about lowering the amount of years it takes to graduate from medical school? I know when we did one of our select committee hearings, they were talking about a 3-year medical program and then doing their residency. So that'll help, number one, with reducing the debt, but you encourage individuals going to primary care. Is that something you guys have thought about at all or not?
I know it's been talked about. I know there have been people in medical school faculty and training programs looking at that. And certainly it's something worth considering. We just want to be sure that the students get the education and training that they need.
Okay, well, let's talk a little bit again about workforce and filling that void. I agree that obviously we need to make sure we encourage more individuals to go to medical school, get them to do the residencies in areas of need, build more medical schools, increase the pay to primary care providers and Medi-Cal. Of course, you know, those are all very, very difficult things. And literally in a year, we're going to be having close to 4 million new individuals are going to be mandated by health insurance. But I really have been an advocate of increasing the current workforce that we have and utilizing individuals at the maximum of their scope of practice. For example, like nurse practitioners, physician assistants, pharmacists. Tell me what your thoughts are in using allied health professions to it's part of the medical home and how they're a big part of it. What are your thoughts on that?
Absolutely. One of the main tenets of the medical home is team-based care. And so that means physicians working with nurse practitioners, nurses, physician assistants, as you said, pharmacists, social workers, chronic care nurses, helping to deliver care. For example, I had a patient who, a 55-year-old woman of mine who hadn't been in several years. Well, she was called by the nurse who had looked in our electronic database and saw that she hadn't been in, asked her to get her mammogram, ended up coming in, and because she did that, we ended up picking up a breast cancer that we wouldn't have known. Now, I didn't have to do that. That was something that the nurse did on my behalf, so that team approach can often really deliver better care.
Well, and it sounds like everything revolves around the medical home model, which obviously you know is the bill that I'm carrying, and you guys are supportive of it. Let's expand upon that a little bit more, because I think obviously dealt with the fact that we're going to have a lot more people we're going to have to serve. We're going to get, unfortunately, with the governments having less money in their general funds, you know, we're not going to see an increase, maybe temporarily for the first couple of years with Medi-Cal to increase their fees, but after that, we need to look at working more efficiently, seeing more patients at a lower cost and more collaboratively. So tell me a little bit more about the medical home and why you think that's so important.
Absolutely. One of the ways that the medical home can pay for itself is by delivering appropriate care. We can prevent things like needless emergency room visits and hospitalizations. There have been some demonstration projects. For example, in North Carolina, they created a Medicaid medical home project and ended up saving about $1 billion in 4 years by putting that population into a medical home, mainly again in saving emergency room and hospital usage. So that sort of thing can really be where it pays off. Group Health in Seattle did the same thing in their clinic. They were able to show that it paid for itself. So even though you have these extra staff people being part of your team, because people are getting the right care when they need it, it ends up saving you money.
Right. So in other words, we're not utilizing it the most inefficient way. So in other words, patients won't wait to the last minute to get care at the emergency room. We take care of it through the medical home to reduce costs. And I think we need to also look at shifting from, and I'll ask you this question, from treating people who are ill to making sure we treat to keep people healthy. And we need to change the way we treat and do our health care in this country and this state. And what do you think of all that?
I couldn't agree more. One of our big problems is we're very good at taking care of sick and very sick patients. If they can show up at a hospital completely uninsured and we'll put them in the ICU and do everything they need, but if they want to go to a doctor's office for primary and preventive care and don't have insurance, that's a lot harder to do. So I completely agree. We need to change our focus and do more on primary and preventive care.
Now tell me again about the medical homes. How do you think it fits into the ACA? Because I know at the federal ACA, it references it, and in California we're trying to define it. So how do you see the two working together again?
Well, again, as you know, you're the author of Senate Bill 393, which we're a large supporter of, to better define, to actually define the medical home, because we think a first step is getting that definition sort of in writing as the first step to making the medical home go forward.
Right.
If we can do that, we just think that that's going to be the best start for how we get the medical home going.
Perfect, perfect. One final question. With regard to reducing costs and payment reform, do you believe that we need to look at any kind of payment reform now? I know if you look at Medi-Cal, for example, it's moving away from fee-for-service to capitation or a capitated form.
Mm-hmm.
Do you think that that should or is going to be part of the ACA, and how do you see your association or your profession moving in that direction?
Absolutely. Right now, much of the healthcare system is driven on sort of paying for things done to people. It needs to shift to paying for coordinating care. I mean, really what's important is to have well-coordinated care, good primary and preventive services being done. That's what's going to keep people healthy. If we pay for doing more to patients,
right,
we'll have more things done, but they won't be any healthier.
Right. So bottom line is we have to make sure we get more individuals into primary care to go in the areas of need, coordinate that care through the medical home, make sure we treat people to stay healthy as opposed to treating them when they're sick, trying to keep them out of the ER and as much as possible out of the hospital. Of course, you're going to need hospitalization as needed. But if all of that works the way it's envisioned, the ACA should work and we should move forward. Obviously, most important is making sure we address the need in the workforce. But with that, I want to just thank you for coming to Sacramento, spending some time with me. Again, congratulations on being president,
Thank
and
you.
I wish you the best of luck. And you're probably looking forward to being a past president, right?
That'll be fun too, sure.
All right. Well, sounds good. Thanks for being with me here in Sacramento.
Thanks very much.
Sure.
This presentation of Vision for California with Senator Ed Hernandez featured special guest Dr. Stephen Green, president of the California Academy of Family Physicians. We invite you to check back for upcoming segments. Thank you for watching. We'll see you next time.